Welcome back to Gynophiles. Today we're going to talk about induction methods. There are so many ways we can induce labor. Just like there are so many different recommendations for inductions. Maybe it's an elective induction, or you have gestational hypertension, preeclampsia, diabetes, whatever it may be. There's so many recommendations out there of when to induce. Let's go over all the possible ways to induce your labor so that you feel educated and empowered. First of all, let's talk about what needs to happen. How exactly does the cervix change? The cervix, or the bottom part of the uterus, first needs to soften and open up. This is called ripening. Ripen equals soften. This naturally begins to happen in the weeks before labor begins, but when we start your induction, we want to check your cervix to see what stage you're at. We're gonna check dilation, but we're also gonna see how soft and thin that cervix is. This is called effacement. Sometimes when you come in for your induction, your cervix isn't ripe yet, so we need to ripen it. Here's what we can do to ripen your cervix. For medications, we use things like prostaglandins. One medication is called misoprostol or Cytotec. It can be given by mouth or vaginally. The medication is Cervidil. Cervidil is like a little thin string that's placed vaginally up by your cervix. It can also help the cervix ripen with a Foley balloon, also called a Foley bulb. This is a device that is inserted through the cervix, so you have to be at least 1 centimeter dilated, and a balloon is blown up on the inside part of the cervix. This Foley balloon mimics the baby's head, so it puts pressure on the cervix, helping it to dilate and soften. Say you come in for your induction and you don't need cervical ripening. What things can we do to start your induction then? You can break your bag of water. This is called an artificial rupture of membrane. Oftentimes breaking your bag of water starts contractions, so that's something we can do. You can also use a medication called Pitocin. This is given through an IV. This is just like the hormone oxytocin, which causes contractions. Once the Pitocin is started, you can expect contractions to start after about 30 minutes. Another thing you can do, surprisingly, is nipple stimulation. This was studied in low-risk pregnancies, unilaterally, and in patients that already had a favorable cervix. Honestly, the data here isn't that great, but if you're ever in a pinch, you can do nipple stimulation. Remember, everyone's experience of induction is different. So don't compare yourself and your situation with someone else's, especially someone here on social media. I want you to sit down with your team of doctors, nurses, support system, family, whoever it is you want there, and decide what's gonna be best for you. Okay, thanks so much for hanging out today. I hope you learned something new. You're about to be induced. I wish you nothing but the best. I'll see you in my next video. Bye.